everyone. We're live. I am so happy to be here on a Thursday with you, and we have our physician spotlight today. So I want to bring back to the stage Dr. Katie Deming. Welcome to the show, Katie.
Hi, Jennifer. It's my pleasure to be here.
Oh my goodness. I have been waiting to get you on this show. You know, I reached out to you several, maybe months ago, and we never got around to scheduling. And then I saw you on Sean Weiss's show, and I was like, hey, I'm going to get you on my show. So I'm just so happy you're here. So how's life treating you these days?
It's good. It's good. A lot of changes, a lot of new things happening for me, but it's been good. And it's a pleasure to be here. Yeah, I honestly think it may have been a year ago that you reached out. So it's been a really long time. And then, it's actually good timing now, though. I think it's better in terms of where I am in my career and everything. So it's a good time. I'm glad to be here. Happy to be here.
It's really great. So I used to work with someone you might know, Jordan Johnson. And
yes.
So I never was, I wasn't really in oncology most of my career until I started working with Jordan. And I just really developed a love for the clients we worked with and some of the patients we got to interact with oncology. And so I have, kind of like this unique story that just happened to me. I was at a conference and my best friend in the whole world, I thought she was calling me to tell me that some good news because she said she wanted to tell me something. And my earth was kind of shattered when she told me that she was just diagnosed with breast cancer. Mm-hmm. And she had recently gone through a situation where she was fostering some children and they went back to their mom. And so it was just like a really scary time for her. And I was just thinking, man, this is the last thing she needs right now. And it's just when I told her, I said, you got to listen to the Born to Heal podcast because it is just fabulous. So the first thing I'm going to ask you today is what makes you passionate? What made you go into the field of oncology when you decided, what was that moment for you when you're like, this is what I want to do?
Yeah. So as an undergrad, I was a biopsychology and neuroscience major. And at the time, I thought I could really do two things with it. Now, obviously, you can do anything with an undergraduate degree. It doesn't lock you into anything. But I was like, well, I could do research or I could go to medical school. And I really actually didn't. Research would not have been a good fit for me. And but my mom was like, I don't think you want to be a doctor. She was a nurse practitioner and she worked in the ER. And she just was like, I don't know that that's what you want. So I was like, okay, well, what would be the hardest part about medicine? Like, what do I think is the part that I couldn't handle? And let me go see that so I can maybe cross medicine off my list. And so I had never had anyone close to me die. And so death was actually very scary for me. And I thought, you know what, I'll go volunteer at hospice. And then that'll just wipe me clean of my need to explore medicine as a field. And as you can tell from where I am now, that story did not turn out the way that I expected, and it changed my life. So being around people who were facing life-threatening illness, and most of the people at this particular hospice either had AIDS or had cancer, I really bonded with the people who had cancer. And I was like, this is what I want to do for the rest of my life. Not because I loved the science, but because I love the intimacy that is available in the space with people who are facing cancer. It's a real time, life gets real when someone's diagnosed with cancer. All the fluff, all the, pleasantries and stuff fall away, and people start getting really clear about what the meaning of their life and why they're here. And I wanted to be around that. And that's really what led me into the field of oncology. I went into medical school knowing I wanted to be an oncologist.
Well, that's just fascinating. I think a lot of us struggle in life to find our passion. There's a lot of people, whatever career you choose, where you just aren't sure it's where you're supposed to be. And you may kind of shift. I've talked to a lot of my colleagues that have, one of them I know was actually doing something in the legal field, or they were actually an artist. And something happened in their life. They're like, I want to go to the medical side. And, it fascinates me what brings people to healthcare, even from other industries. But we all are passionate about healthcare, most of us. And so I started this new podcast, Healthcare Inspired, but season 2 is about really just being truthful and authentic. And we're all looking for truth in our lives. We go to the doctor looking for, answers. And sometimes we don't always feel, in some cases, that we're getting the answers that we're searching for. And so I wanted to ask you, when you think about authenticity as a physician and in patient care, what are some of the things that you have always tried to do to stay authentic in your passion?
Yeah. Well, what's interesting is that even though I entered into oncology and then, specifically practiced radiation oncology for 20 years, I just made a big shift because I knew I wasn't being authentic in practicing radiation oncology, and ended up leaving, the Western medical system because I knew it wasn't authentic to what I was supposed to be doing. Not that there was something wrong necessarily with radiation, but that I knew it wasn't what I was supposed to be doing. And this is one of the things that, death has been around me ever since this first experience in hospice. It's funny, I went into doing that volunteer work because I was afraid of death, but now being so close to death, I've cared for over 5,000 patients, and close to half of my patients were considered palliative. So ultimately, the treatment that they were doing was not curative. And so I've spent a lot of time around people who are facing the end of their life, and they almost uniformly say, I wish I had been true to me. Like, I wish I hadn't listened to what everyone else wanted me to do. I wish I had lived my life. And so for me, that's always been important in my practice and always been like very close because I've had this constant reminder in my career. And so with patients, I really think when you're sick, it's a important time to start to get really honest with yourself, because cancer or any illness is considered a crisis, right? So this is a crisis in people's life. You just described that with your best friend. So crisis in Chinese is symbolized by two symbols. The first symbol is danger, which makes sense. The second symbol, though, is opportunity. And so in a serious illness like cancer, there is opportunity to change and to shift. And this is actually what I loved the most about being with people, is when they're cracked open like that by the diagnosis, it allows them to start to make choices to get aligned with who they are. And I think that, some of the things that make us sick that we're not talking about in Western medicine are not being aligned with ourselves. Like when we are living a life that is not aligned with who we are, it can make us sick and stressors in our life. It's funny that you mentioned your friends, the issues with the foster children or what that situation, and that the last thing she needed on top of this was breast cancer. But I would argue they're likely related.
Interesting you say that. Yeah.
Yeah. So stress affects our bodies physically. And now that I understand this connection between emotions and also how we're living our life, and then the development of illness, like I'm seeing this connection all the time, that people have some major stressor happening and then their body gets sick, and it's our body's way of telling us, hey, something's wrong. Like we need to stop here for a minute. And the cancer may not be the problem. Of course, it's something we need to address, but there's something deeper underlying that needs to be healed. So for me, I feel like I've always brought this to my patients, this idea of really being true to yourself and making some hard decisions when you're facing a diagnosis like this. And I've always loved the time in the exam room. Like I never really loved radiation. Like I did it because that's what, it's like, you want to be an oncologist. So there are 3 ways that you can do that. One is you can give chemotherapy, which I knew I didn't want to do. The second was radiation, and the third was surgery. And so it was just like, this is what I do, radiation, but it wasn't like I loved radiation. I was like so excited about radiation. What I was so excited about was the time that I had in the room with a patient by myself, and where they had someone who could listen to them, and really understand them. Because I think you said this also, people go to the doctor looking for answers and oftentimes are disappointed. You didn't say this, but I'll say it, that a lot of times people are disappointed. And I think that one of the things that I've always known is that the healing comes from within. And so the more we can inspire hope, the more we can empower patients to really see that they hold the power inside, like that's exciting. That's what I love to do. That, and that's more of what I do now, you know, as an integrative oncologist. That's what I'm doing. But I think this idea of authenticity is scary for a lot of people, because a lot of people aren't living an authentic life. You know, there's
Very
a
true.
lot of things that people would change if they could, but it's hard. You know, it's hard to change things in your life to become more authentic with who you truly are.
I 100% agree. So I want to talk about your podcast because it's an amazing, just title, Born to Heal. So because you talked about this integrative medicine you're doing, tell our audience a little bit about what that entails for you and your patients, and the way you're doing things now compared to when you were maybe part of a hospital system. How has this changed maybe a patient's perception of how they heal and how they get care?
Yeah, well, my understanding of healing has completely flipped in the past. It's been 18 months now since I left Western radiation oncology. But so my practice is an integrative practice, which basically looks at the whole person in a holistic manner. And the things that I've learned, so when I left, I didn't know what I wanted to do. I just knew I needed to leave. Like, I wasn't aligned. And then I took a little over a year to really dive into what is healing. Like, I was taught in medical school pathology. So the way that medical school is set up is we learn the organ systems, but we learn it from a pathologic standpoint. Like, when something goes wrong with a particular system in the body, this is what it looks like, and this is what you do to restore it. But I never learned, like, well, what does it look like to have a body that's in optimal health? And, looking at our organ systems from like optimizing rather than just fixing what's sick, right? And so that's what I spent my time really diving into. And the things that came clear to me was that any healing program is not just the physical things that we do. Like in medicine, most of what we do is we give prescriptions, or in my case, I gave radiation, and it's the physical things that we do to someone. But the physical aspect is important, but any healing program needs to have an emotional component, because there are studies that show people who experience emotional trauma as children have higher incidence of illness, like cardiovascular disease, cancer, COPD, diabetes. And we also know from some of the radical remission work, so Kelly Turner studies people who cure themselves of cancer or other illnesses without treatment. And two of the things that the people do, there are 9 things that these people have in common, but 2 of them are related to emotions and releasing trapped emotions or suppressed trauma, and also helping with emotional fluency, moving out of anger, fear, jealousy, what we would consider like negative emotions. So I knew that you needed this emotional component. I also saw that there was a mental component. And specifically, not just our conscious mind, which most of us, that's what we think about, the things that we think all day, the things that we are consciously aware of. But a lot of our behavior and a lot of the things that get programmed into us are in the subconscious mind. And the subconscious mind is responsible for 95% of what we create in our life, our behavior, our actions, our words, what's created in our physical body. 95% of it's driven by the subconscious mind. So I knew this like mental component was also important. And then it's interesting that you bring up authenticity, because spirituality, when I think about it, about healing, is less about like, what do you believe in, God or whatever that piece. It's more about aligning with who you truly are. Like, are you living a life that is aligned with the person that you came here to be? And that, in many cases for people who are sick, is misaligned. And so what I learned through my studies was that to create optimal health and to heal an illness, you need to have a holistic approach like this, and you need to be addressing all aspects of this. And so my practice now is really balanced. And one of the things, integrative medicine can be totally different. You could have two different integrative oncologists and they practice completely different, and they may focus more in one area. Like one may be more into herbs and supplements and, IV therapies and whatever, and another one may be more into the emotional work. And for me, mine is a very balanced approach that, like, we have to do all of these pieces in order to restore health in the body. And so that's really where my practice is now. And it's very different than what I did before. And I have very different thoughts about treatments and like the treatments that we do in Western medicine, and that there are a lot of things that we could be doing that are less toxic to help people heal and less of the toxic stuff. So I'm not totally anti conventional medicine, conventional chemotherapy, radiation, all that, but I would love to see us shift and use that less, because I think there are so many things that we are not accessing, we are not doing, and are not taught, frankly, to our doctors, our medical students. I was not taught these things. So I know that it's not my colleagues' fault. They were trained in a system, but we have no training on nutrition. None.
I love that you said that. Oh, yes.
Most doctors, and I was at a conference, this was last year, so last fall, teaching kitchens. And basically this was about bringing food and cooking and teaching people how to cook into hospital systems and schools and that kind of thing. And they had a whole lobby group that they were working to get nutrition taught in medical schools. And they had like a couple of awesome attorneys, and the only thing that they could get past is that it's optional for medical schools to teach nutrition. And this was like, I knew that I wasn't taught nutrition, but I was figuring now they must be taught nutrition. They are not. And so, and cancer, frankly, is a metabolic condition. Like, now that I understand that, so I just interviewed, oh my gosh, I can't believe I'm blanking on his name. Basically, cancer is a metabolic condition. He's from Boston University. I'm sure his name will come to me in just a minute. But basically, he talks about the Warburg effect, and it really comes down to metabolism in the cells. And cancer is a dysregulation of the metabolism that has switched from oxidative phosphorylation to anaerobic glycolysis. And this happens in every case of cancer. And yet doctors are taught nothing about this. And so it's just that kind of thing where my goal would be that we are learning more about how the body actually works without introducing drugs and stuff first, so that we can use these things like that. You can actually put people's cancer into remission by using metabolic approaches, fasting, and also really lowering carbohydrates. Anyway, long story short, I'm doing all of those other things now because it's exciting. There's so much that you can do.
I really appreciate you saying that. So I live in Northwest Arkansas, which is where Walmart matriculates from. And so Alice Walton has put in place Awesome, which is the Alice Walton School of Medicine. So it's a new medical school here. It's a beautiful campus. I kind of drove near it the other day just to see how it's coming along, but it's kind of geared towards that. It's really, her focus was to create an environment where all of those things, physical, emotional, mental, all of those things are explored in medical school for these physicians. And knowing her and, what she pushes in our community, it's all about staying healthy. Like, we have bike trails all over this area. People actually move to Northwest Arkansas just for our bike trails, by the way. Oh, wow. And it's crazy. So, those things like that, I feel like if more medical schools really took that approach, incorporate some kind of training where it's, in my world, in billing and coding and revenue cycle and compliance, we're always preaching to physicians to tell us your thought process. And I would love to see that thought process documenting how their physical and emotional health is being affected by drugs or by their emotional health. Because we have the social determinants of health that we would love to see reported more, to show the communities these patients are having real emotional, mental, physical breakdowns in their life, and it's affecting their health. And we are supposed to be reporting that, because if you report it, then again, the communities can be aware of it and we can get resources to these people that they need.
Mhm.
So it's in our world, we're all about reporting these things, all for the benefit of the patient. And in your world, you're trying to get the word out that it's more than just let's examine you and give you a procedure and give you some medication. It's about let's find out the root cause of
Yeah.
what's going on with you. I find my dad's wife, after my mom, my stepmom, she passed away from cancer. Oh, it's okay. My dad, his previous wife, she passed away from cancer. She actually had a sarcoma, and so it just kind of ate her up. And I just remember after she passed away, my dad just went into full on diet mode, and he was doing all kinds of research on food he should be eating to alkalize his body. And so he was always pushing that on us, like really focus on what you're eating and how it could be affecting your body.
Yeah, absolutely. Well, and I love that medical school is, coming in there. I think that it requires, people with a vision with money. Honestly, it has to be funded by someone who is not tied to, pharmaceutical industry and that kind of thing, to create a different paradigm. The unfortunate thing is that then those medical students will graduate and then they're put into protocols. Everything, the way that we treat is done by protocol, and the protocols do not have, they'll bring these things, but it's still the system. So it's like we need more schools like that. I love that idea and mission that she has there, and I love that your community is more active and healthy because of what they bring in there.
100%. I feel blessed to be where I am, and I love just being out in the community. And I also, want your take on this. I personally went through some mental health challenges during the pandemic, like most everybody else. I was already feeling mental stress from a job I had previously, and I was doing okay. I was getting better. And then the pandemic hit, and I felt like I went down to square one again. And I think a lot of people, when I get out in the community, people just aren't as social as they used to be. I feel like, and we know the mental health crisis is even more today than it was maybe 5 years ago. But again, just having conversations with people in the community has decreased. Like people just don't walk up to each other anymore and just have a conversation. And I feel like in our community, we did have that previously. In the South and just some of these smaller communities, we had that. And people just don't interact with others the same as they used to. But I think there's a component to that too that is beneficial to our health to interact with other humans. I would love your take on that.
No, absolutely. I mean, this is the whole thing about lockdowns, is that was very detrimental. And, now that I understand how the body heals, it's like human connection is one of the most important things. And, and going out and living your life and being active and getting fresh air and sunshine, and, all of these things are important. And basically, as a society, everyone was told, be scared. Well, and that's the other thing, is like your emotions matter. So basically fear was instilled, which blunts the immune system. We stopped interacting with each other. We stopped touching each other. And actually that one was really hard in the clinic, because we were told not to touch our patients. And for me, I didn't realize that, like, I actually touched my patients quite a bit, and that was, these things that we were taught to do isolated all of us. Even when we were, in proximity with people, we weren't touching, we were, keeping distance, all of those things. And so I really think that it had a detrimental effect on us, and people get conditioned. That was a prolonged period of time where people were isolating, and that has implications, and not just on the communities, like in adults, but children. So our children stopped communicating and getting scared. Like one of my daughters, she's 17 now, she's getting ready to go to college next year, but she really loves big cities. But after COVID, she was afraid. She was like, I can't go. We went to visit Seattle, and Seattle's not that big of a city, but she was thinking she wanted to go to school in New York, and we went to Seattle, and she was freaking out. This was like about a year after COVID. And she just like was afraid, being around so many people, because she just hadn't been. They had been homeschooled. And so anyway, I think that the ramifications of that are huge, and we see them all over.
Well, and we have the concept of the physician's touch, and, like in general, human touch is comforting and to the human body, whether it's your spouse or it's your mom or your grandmother, your grandfather, like when they give you a hug, like that's healing, and it's emotional, and it's where you feel safe. And so when we couldn't do that, we maybe start to go into this mode where we don't feel safe because we don't have that person there to tell us if it's going to be okay, or to protect us in that way. And those are all real mental emotions. And I don't know if you saw on Twitter or X, they had this viral thing with Elmo, and he came out. They had this video of Elmo, and he came out and he said, "How is everybody doing out there?" And it was like this old video, and it went viral, and everyone just unleashed their emotions on social media. "I'm not okay. I'm having a hard time." And I just got so emotional seeing that. I didn't feel alone anymore. I felt, okay, I am really not alone. Other people are feeling just like me. I'm not okay. And so it was just beautiful to see that.
Yeah, no, for sure. And one of the other things that I'll say is that we hadn't gotten into this, but the science that really helps explain, why we need all of these different components of the healing, the emotional, the mental, physical, and the spiritual, has to do with actually the fact that our bodies are 99.9% water molecules. So like 99.9% of the molecules in our body are water. So we are basically like bodies of water. And as I've started to study Gerald Pollack's work, which is about the fourth phase of water, and this is like that we think of water as in three phases, liquid, solid, ice, and vapor, steam. But what he describes is there's a fourth phase of water, and it's a gel-like phase. It's a crystalline phase. And basically, healthy cells have this easy or crystalline water in the cells. And one of the ways that easy water is built in our cells is through infrared. And infrared can come from the sun, could come from a sauna. It basically is all around us, but it also comes from human connection. So the human connection not only affects us emotionally, which you described, we don't feel safe when we're not able to connect. We feel alone. We feel, kind of contracted in ourselves and not realizing that we're not connected, that disconnection, right? But it also physiologically affects the water in our cells, which ultimately impacts our health. And so that's like why dogs, there are studies that show people who have animals live longer. People who are married live longer, having that contact. So having someone that you can touch and connect with is important for emotional health, but also physically it's affecting us and impacting us.
That's beautiful. And it's so nice to hear the science behind it, because sometimes our logical brains just want to know the reason behind the way we react to things. And that's why it's so important to understand your mental health, because there's a reason, a chemical reason, a scientific reason usually behind every emotion that we have. And so I think it's a beautiful thought. And Katie, Dr. Deming.
No, you call me Katie. You call me
Katie. I just love just talking to you, and I wish we could talk all day. But before we go and leave our audience, I want to just kind of get final thoughts. First of all, where can our audience find you if they want to hear you some more?
Sure. So my podcast is relaunching actually next week on February 13th, Born to Heal with Dr. Katie Deming. It's on Spotify, Apple podcasts. So that's a great place to find me. You can also find me at katiedeming.com. That's my website. And I'm hosting a free workshop on creating optimal health and really talking about this piece of the water as the science underneath it and how to create true health, even if you're sick or if you're healthy, like someone who, is healthy but wants to understand, like, how do I stay healthy? Because if you look at the statistics, we're getting sicker as a society. So it's not just for people who are sick, it's also for people who want to create optimal health. But that'll be on March 5th. And so if someone follows my podcast or goes to my website, you can find information about that.
Excellent. Well, thank you for joining the show. And I want to thank our audience for joining in. And if you didn't get a chance to listen in live, you can listen to our audio podcast and you'll find this video on YouTube. So stay tuned for more episodes. And thank you again to Dr. Deming for joining the show. You guys have a great day.
Thank you. My pleasure.